Good morning or afternoon. Hello. Got some people still hanging out in the waiting room and joining in. So melting in Halifax. Does that mean it's hot there? $30 degrees. It's 12 here. It is not that hot here. Good morning, everyone. My dog has decided to join us today, so hopefully he just hangs out on the floor and doesn't make any ruckus. Depends on his mood. Okay, so since we are 1 minute after 11, we're just going to get started. There might be some more people joining us, but they can join us, they cannot, it's up to them. All right, so welcome to Thursday. It is Thursday, right? Yes. Yesterday I kept saying it was last week and I was meaning Monday, so the days get away from you when you're at home every day. All right. So before we get started, let's just go over those housekeeping pieces. So the presentation you're about to view is the intellectual property of the Department of National Defense. Any reproduction or retransmission of slides contained in this presentation is strictly forbidden. Some of the topics discussed in this webinar may be of a sensitive nature and not appropriate for children, so we do ask for parental discretion. So today we are talking about other drugs, mostly focusing on illicit drugs, but we'll be talking a little bit about prescriptions and over-the-counter medications. So please keep that in mind if you do have any children around you, that it may not be a topic that's suitable for them at this time. Please understand that people's stories are theirs alone to tell, and anything that is shared by participants in this webinar, either on camera or in the chat, is not to be discussed outside of the webinar. This webinar is being recorded and will be available for viewing later on cafconnection.ca. Although active participation is encouraged, you may simply follow along without using the chat or video functions if you prefer. So I will mention to you, if you haven't been on a session with me before, I don't turn on the video or mic functions at the beginning. I'll do that at the end, and only then for those people who request it so they can ask a question verbally versus type their question out. I don't add it all just because we have a larger group, and a lot of people end up forgetting to turn on their mics, so then we get a lot of background noise, knowing what's going on in the background of your house, right? Another thing is I definitely encourage people to use the chat box that I see quite a few of you are already saying good morning and good afternoon, depending on where you're from. So that's fantastic. There will also just be a couple poll questions, not too many with the polls today. We're going to actually be trying to get more people to answer some questions in the chat today just because of the content. But just keep in mind that the polls are completely anonymous. I can't see who's answering what. I do really encourage you to just participate as much as possible, whatever your comfort level is. Okay, so today we are nearing the end of our addiction series. We only have one more session after this. Today we're going to be talking about understanding other drugs. So as I mentioned, mostly focusing on the illicit drugs, but we will be talking about prescription drugs as well as over-the-counter medications and tips for responsible use of those. If you haven't been on a session with me before, my name is Lisa Fisher, and I am the Health Promotion Specialist here at Four Wing Cold Lake. So first things first, that poll I ask every single time, we're going to ask you what your affiliation is with the CAF community. So I've shared that poll right now, if you can answer that. If you are a serving member, a veteran, a family member, a civilian employee, or other. I will mention that I know that some civilian employees may also be veterans, but just choose whichever answer best describes you at this time. Okay, so we have most people have answered at this point in time. A majority of people are serving members. We've got a family member on the line and a few civilian employees. So welcome to everybody. Now in the chat box, let's test out the chat box function here. I know some people have already said where they're from, but if you haven't, let us know where you're joining from. I know we've got Halifax, Victoria, Gatineau, Ottawa area, Winnipeg, Edmonton. I believe we saw Moose Jaw earlier. Don't think I've missed anyone so far. Petawawa a couple times now. Kingston, Cold Lake, China, Winnipeg, Meadow Lake, Saskatchewan. Saskatchewan or Saskatchewan? It depends on who you talk to, right? Rivers, Manitoba, Kingston. Okay, so it seems like we have Canada representing today, not any outcans that I've seen so far, which is fantastic, all over the country. So different times, might be morning for you and might be afternoon. Not sure if you just heard that, my dog sneezed. He's having a moment. All right, hopefully the weather is decent where you are. We're sitting here about 12 degrees, overcast, might rain again, who knows? It's been doing that for the past couple days off and on. All right, and of course, yet again, I'm freezing in my house, which if you've been on every session with me, you know that that's a normal thing for me. Okay, let's get into the top conversation. So, psychoactive drugs. These are the substances that can change sensation, mood, consciousness, or other psychological or behavioral functions. So all of the drugs that we're going to discuss today fall into the category of psychoactive. So specifically, we're going to be looking at drugs that alter our mood, our perception, and our consciousness. Essentially, these drugs make us feel, think, and perceive things differently than we would if we weren't taking the substance. So does anybody know what the three classes of psychoactive drugs are? The three main classes. Depending on who you talk to, they may divide them a little bit further up, but we're going to be talking about three main classes today. So in the chat, you can answer there. Stimulant, uppers, downers, hallucinogens. Okay, yep, so pretty much it. So we're going to go on to the first one. So the first one would be what was described as a downer, so a depressant. Okay, so when we look at a depressant, it slows down our brain. So essentially, it makes us less aroused and stimulated because it affects our central nervous system. So by doing that, it effectively slows down the brain, leading to a reduction in messages being passed from the brain to the body. Okay, so it does make us less aware of the environment, what's going on around us. Sorry, just give me 1 second. My dog needs to go to the room. Please leave. He didn't want to hang out with us, and apologize. All right. It relaxes, sedates, and calms a person, and it's been known to relieve pain. So what are some examples of depressants, if you want to put that in the chat? Ones that you know of. Alcohol? Yep. All right, so we have alcohol so far. Okay, so marijuana. Cannabis in itself is really hard to classify just because it has different effects in different areas. So it can have depressant effects, it can have stimulant effects, and it can have hallucinogenic effects. So we're not going to really be talking about cannabis specifically today because we had a whole session on it. But essentially, oftentimes we just look at cannabis as in the cannabinoid realm versus trying to classify it as one or the other when we look at the psychoactive drugs. Okay, so here are some examples. We've got alcohol, we've got sleeping pills, benzodiazepines, so such as Valium or Xanax, and GHB is another example. So these are just some examples. There's more than just the ones that are listed on this page here. So we're gonna take a look at just the general effects in small to moderate doses as well as to higher doses. Different drugs are going to have different specific effects short term, but this is just the generalized view. So if you have a depressant and you're taking a small to moderate dose, it's going to reduce your inhibitions, it's going to enhance your mood, reduce your anxiety, slow reaction time, impair judgment, slow your breathing, and increase your risk of accident or injury. Keep in mind these are all individualized, so one person may react differently than another person. If you're going to take a depressant in a higher dose, your judgment and coordination are going to be impaired. You may vomit. You may experience irregular shallow breathing. You may experience blackouts or memory loss, unconsciousness, coma, or it could potentially lead to death. So blackouts or memory loss, that's just, think of alcohol to kind of understand what that means. For somebody who consumes way too much alcohol, you may have experienced a blackout before, or you may have known people that have experienced blackout. So any depressant can provide that effect, not just alcohol. So I'm just going to touch base on a couple, on just one type of depressant here. Because I'm not going to go into every single one. We've already done a whole session on alcohol, so I'm not going to focus on that. But I am going to kind of give you an idea of what benzodiazepines are. And the reason I'm going to talk about these is because they are used commonly for prescriptions, and I just want everybody to kind of understand what they are. So benzodiazepines or benzos are some of the most prescribed medications. So you may have been prescribed one of these in the past, or you may currently be using one. They are generally used to treat people with sleeping disorders, seizure disorders, or anxiety disorders. They are only legally available by prescription. So if they're not being given through a prescription that is legally obtained, then it is legal use. Okay. They can come in liquid, tablet, or that's supposed to say tablet, not table. Tablet or capsule form. Examples, as I mentioned before, would be Valium or Xanax. However, use can become problematic, and so therefore they are controlled under Schedule 5. The Controlled Drugs and Substances Act. So they're often used as sedatives and tranquilizers, and they can lead to a substance use disorder. So just because they're a prescribed medication doesn't mean that you can't become addicted to them, okay? Another long-term effect of benzos are also problems learning and or concentrating. You may have been given a benzo as a short-term thing for anxiety. So for example, I have huge anxiety when I go to the dentist I can deal with cleanings, but when it comes to, cavities and things, I end up getting Ativan, right? And that's just so that I can be calm during my dental experience. So it's just more of a short-term thing. If you are on it long-term, then, you don't want to definitely have that continuous conversation with your healthcare practitioner. Okay, so somebody also mentioned stimulants. So that's another class of psychoactive drugs that we're going to take a look at. So stimulants are acting the opposite way of a depressant in that they speed up the brain because they speed up the functions of your central nervous system. They make you more aware of your environment versus depressants make you less aware. And they increase alertness, endurance, anxiety, and restlessness. So they do increase your heartbeat. They often make you feel as though you can accomplish many, many things, maybe things that you wouldn't feel like you could accomplish without that substance. They give you what's called a speedy brain. So your brain's very amped up and makes you definitely more aware. And that anxiety and that restlessness can be to the point of agitation. So somebody also mentioned uppers. So they are also called uppers. So if you've ever heard somebody talk about taking an upper, they are likely taking a stimulant. So what are some examples of a stimulant, either illicit or non? Because I do have a couple in here that are, people take pretty regularly. Speed, caffeine, Coke, meth. People knew what the stimulants were. They struggled a bit with the depressants, but knew what the stimulants. Yeah, Adderall. Yeah, okay, awesome. Wellbutrin, anabolic steroid. Okay, so here are some examples that I have here, and as I mentioned, that's not all of them. So caffeine, which somebody did mention, that is the most widely used psychoactive substance in the world. Nicotine as well. So if anybody uses tobacco or they vape with nicotine. Cocaine, which somebody mentioned, Coke. And methamphetamines or meth. So as I mentioned, just some examples. There's definitely some more. So let's look at those general effects of stimulants based on the dosages. So if you have a small to moderate dose of a stimulant, you could experience euphoria. Generally, that's what one of the reasons people like to use it. Heightened feelings of well-being, your heart rate and blood pressure may increase, alertness would increase, talkativeness, and reduced appetite. In higher doses, you may experience anxiety, tension, increased body temperature, nausea, tremors, seizures, coma, and could lead to death. So I'm going to go into just a few different types of stimulants just so that we can have a bit more of an idea about them, either because they're more well-known or they're more commonly used. So cocaine is the first one we're going to mention. So cocaine is also known as sea, rock, snow, coke, or blow. And somebody did mention coke earlier, and when I asked what the stimulant was. Cocaine is very highly addictive, and it's made from the leaves of the coca bush. So cocaine can be snorted, injected intravenously, or smoked. And crack, so you might have heard of crack cocaine, that is the form of cocaine that is smoked. So it can also be injected intravenously, but generally it is smoked. Smoking or injecting crack in higher doses is more addictive than smoking regular cocaine. So if you're choosing to use crack over just regular cocaine, chances of addiction is way higher. It is controlled under Schedule 1 of the Controlled Drugs and Substances Act, and it can lead to a variety of mental and physical long-term health effects. So examples of those long-term effects are physical changes in your brain. So they can increase ongoing mental health effects, which include depression, sleeping problems, extreme changes in mood, erratic or violent behavior, paranoia, hallucinations, delusions, or psychosis. You may also experience long nose and breathing problems, including severe chest pain, low blood oxygen, difficulty breathing, collapsed or inflamed lungs, coughing up blood from the lungs, losing sense of smell, frequent nosebleeds, or developing a hole in the wall between the nostrils. Cocaine also has been found to stress the heart, which leads to that high blood pressure and a faster regular heartbeat. Those things increase your risk of heart attack. If you are using alcohol and cocaine together, that further increases that risk. And of course, because of those cardiovascular issues, you're also at higher risk of stroke. Stomach issues include your nausea and vomiting, changes in appetite, and bowel perforation and decay. And other physical problems could include impotence in men, low libido, brain bleeds, and pregnancy issues if a woman uses while pregnant. The harm gets worse the longer somebody is using it. Okay, so there is harm regardless of how many times you use it. So even if you just use it once, you're going to have harm associated. But the longer you use it, the more harm that could come to you. Okay. Methamphetamine. So this is also known as ice, meth, chalk, crank, or crystal meth. Again, this is highly addictive. It does come in powder, crystal, or tablet form, depending on how you get it. And it can be smoked, snorted, injected, or swallowed. It is controlled under Schedule 1 of the Controlled Drugs and Substances Act and can have dangerous and unpredictable short-term mental health and physical effects. So those effects usually last 8 hours, but can be up to 24 hours sometimes. And users who binge on meth display highly focused and repetitive behaviors and may experience sleeplessness, paranoia, and or hallucinations. Bingers often are irritable and prone to unprovoked aggression. And once they've had their binge, they generally do crash, where they could sleep for long periods of time and feel hungry, depressed, or anxious, all the while craving their next binge. Okay. It can also cause long-term mental and physical health effects as well, including that permanent brain damage, which leads to the inability of the brain to produce chemicals that are vital to us, and the inability to control urges and the loss of hand and finger dexterity. Could lead to long-lasting or permanent aggression, psychosis, and or paranoia. Meth users may also be at an increased risk of suicidal feelings, especially during withdrawal. And the most dangerous long-term physical effects of meth use are cardiovascular. You can also see severe poor nutrition, weakened immune system, severely damaged skin, which will also include the potential sensation of insects crawling under the skin. As well as some of you may have heard of meth mouth, which is a permanent bad taste and cavities or lost teeth in the mouth for meth users. Okay, so those are the two illicit ones I'm going to cover, but I'm also going to cover prescription stimulants, and that's because they are used illegally and incorrectly. So prescription stimulants are most used to treat individuals with ADHD, but they've also been used for treatment of narcolepsy and other sleep disorders. Examples include Ritalin, Dexedrine, Adderall, other examples as well. They are primarily consumed in pill form for medical use. However, for people who choose to use them non-medically, the reasons are varied, including to get high, to improve their mood, to reduce appetite, cope with stress or other problems, enhance focus or increase alertness, and improve academic performance. So when you look at high school and university students, that is definitely a concern when you're looking at somebody who wants to improve their academic performance. If you've ever been to college or university, you may have met people that have taken stimulants in the incorrect way in order to be able to focus and pull those all-nighters. There are short-term and long-term health effects, though. So whether you're taking it as a prescription or you're misusing it, of course, misuse can increase those risks because you don't have a healthcare practitioner that's following you along the way, right? Repeated use can lead to feelings of hostility and paranoia, and at high doses, it increases your risk of heart attack, stroke, and lethal seizures. So keep in mind that people who misuse don't generally know what dose they should be taking, so there is a higher risk of a higher dose. And prescription stimulants can lead to tolerance and lead to substance use disorder, whether they're prescription or not. Of course, as a prescription, your healthcare practitioner will be watching for those signs. Okay, so hallucinogens. We've also mentioned those as a type of psychoactive drug as well. So hallucinogens are also, are also referred to as psychedelics, and they distort the awareness of our environment. So they do change the way we perceive things because they change our senses. So they change the way we see, hear, feel, all of those things. It also affects our moods and our thoughts. Now, at high doses, it may cause a person to hallucinate or to see, hear, feel things that aren't real. So what are some examples of hallucinogens? And you can just type those in the chat there. Mushrooms, ecstasy, acid, MDMA, LSD. Awesome. Okay, so definitely some examples there. So I'm going to put some up here. Examples include LSD, somebody mentioned, psilocybin, which would be the magic mushrooms, ecstasy, and salvia. So I'm going to go over your effects, and then we'll go over a few of those drugs. So effects, you'll see there's now the table for short to moderate to high doses, just because hallucinogens, the effects can vary considerably depending on the person. Those effects can include euphoria. You could feel very relaxed, feel really good. You could, of course, see and hear things that aren't there. You could be confused and have trouble concentrating, be dizzy, blurred vision, be clumsy. Your heartbeat could be faster, irregular. You could be breathing really quickly. Potentially, you could be nauseous and or vomiting, sweating and chills, or be very numb. So it really depends on the individual how they're going to experience hallucinogen. There is such a thing as a bad trip. So bad trips are frightening and disturbing hallucinations. They can lead to panic and unpredictable behavior. And when you take a larger amount or a stronger dose of a drug, then it can increase the likelihood of you having a bad trip. The most common long-term effect of using hallucinogens are flashbacks, and those are re-experiencing the drug. So essentially, whatever you experienced while you took the drug, it would be a re-experiencing that. And that can occur days, weeks, months, or even years later. So that can be quite frightening for some people if they're really not expecting that, especially if it happens months or years later, right? So let's take a look at some of the drugs. So magic mushrooms. The reason I have them in quotation marks is just because the natural active ingredients in magic mushrooms are psilocybin and psilocin. So, you know, in medically, that's what they're called, but everyone knows them as magic mushrooms, right? So psilocybin and psilocin are controlled under Schedule 3 of the Controlled Drugs and Substances Act, and they can be sold as a powder or in tablets or capsules and can be injected intravenously. However, when you look at magic mushrooms, those are sold as dried whole mushrooms or as a powder, and they are eaten raw or cooked drunk as a tea or mixed with fruit juice, or snorted when in powder form. The strength of magic mushrooms can really vary, so you need to keep that in mind if that's something that you are ever choosing to use. Use does not generally result in substance use disorder. However, there are lack of studies on long-term effects of repetitive use. So just because there's a lack of studies does not mean that magic mushrooms are safe to consume. There just means that they haven't gotten to the point where they know what those long-term effects are going to be. Okay. LSD. So a little bit smaller print here, but LSD is also known as DOTS, acid blotter, window pane, mellow yellow, or California sunshine. It is made from lysergic acid, which is found in a fungus that grows on rye and other grains. So fun fact for you. In pure form, it is white, odorless, and a slightly bitter crystalline powder. However, on the street, it is often sold as small squares of blotting paper or absorbent paper. It can also be sold as powder capsules or tablets. So though the powder can actually be made into miniature powder pellets called microdots, and the crystals can be dissolved into liquid. So when you're looking at the crystals being dissolved, they can be made into breath freshener droppers, or they can be applied to substances. So those substances could include gum, candy, sugar cubes, postage stamps. So they definitely have many ways where you can take this, many ways in which you can take the drug. Again, that's controlled under Schedule 3. Health risks are frequently more mental than physical. So they have found that it can have long-lasting effects on your brain and emotional state. And sometimes those effects can continue for years, include the paranoia, the psychosis, flashbacks, and depression. However, it's not been found to cause physical dependence. Yeah, so those long-term effects, it's also important to remember that you don't need to have taken it multiple times for it to affect you. Only one use can actually increase long-lasting effects. So just keep that in mind if that's something that you've ever been thinking of trying. This is, a controlled drug, so it's not something that is legal for you to be taking as well. So the reason I'm mentioning is because people still choose to take these drugs, and I just want you to realize all of the issues that potentially could happen if you do choose to do it, or somebody you know is choosing to. Okay, so MDMA or ecstasy, as somebody else mentioned. Yes, I said postage stamps. LSD, the crystals can be dissolved into liquid and added to postage stamps, so you can lick a postage stamp and get high. So ecstasy is frequently taken at parties, raves, and music festivals. So you've probably seen a lot of, news articles and stuff around that. I know that Edmonton, they had some issues with that a year or two back. I remember that coming in. And back in Nova Scotia, there was also, I don't remember the festival, but there was a festival that always happened, and this was a concern. So it is often swallowed in tablets or capsules. Tablets do vary in size, shape, color, and the amount of drug that it contains. And they're often stamped with names or logos. Don't be fooled, though, because those names and logos does not identify what is in the pills, and they don't mean that the pills are safe. It just means that that's kind of just the brand that the drug dealer has used. Okay. They are often mixed with other substances because it's cheaper to add other substances in it, or it makes it more of an effect if they're adding different substances. So common additions include ketamine or PCP, as well as stimulants such as methamphetamine, amphetamine, or cocaine, or they may add novel psychedelic drugs to it. So lots of things could be in that little tiny, bright-colored, happy face pill that you're consuming. Again, they are controlled under Schedule 1, and they can lead to long-term effects. So mental effects will include, again, paranoia, depression, hallucinations, also sleeplessness and mental confusion. Delusions and other psychotic symptoms can last for several days or weeks from some people after you've taken the drug. And repeated use can lead to kidney or liver damage, decreased libido, damaged brain cells and memory problems, chronic exhaustion and fatigue, chronic muscle aches, decreased appetite, nausea, vomiting, and weight loss. Ecstasy can be addictive as well. So you do need to keep that one in mind. And using MDMA can be especially harmful if you're diabetic or epileptic. or if you have problems with your liver, your heart, or your kidneys. If you use it with an antidepressant or any drug that is used to treat HIV, there's been links to serotonin syndrome, which is not good as well. And dehydration is also a concern because MDMA increases your body temperature, so there's a higher risk of dehydration, especially if they're being used at a party or rave or a music festival where you're dancing already and sweating a lot. However, if you drink too many fluids because you're so parched, there could be, of course, that danger of an electrolyte imbalance. Okay. All right. So I've talked about depressant stimulants and hallucinogens, but I also want to focus a bit on opioids as well. That is because you've probably heard of the opioid crisis that's happening. Opioids are definitely a concern in Canada as well as other places in the world. And I wanted to include this because I think that a lot of people don't really understand exactly what it is and what the concern is. So when you look at opioids, they do alter our perceptions of pain. So they are used for pain as pain medication, generally when prescribed. However, they slow down our breathing, our heart rate, our thoughts, and our actions. Opioids are derived from the opium poppy or from chemicals to provide or intensify the effects of the natural opium. So it depends if you're using a natural opioid or you're using a synthetic. It can be manufactured in regulated labs and used for medical treatment, which is what we would like to only see it used for. However, it can be made in illicit labs and, of course, then used illegally. Opioids that are manufactured in regulated labs can also be misused because you can have somebody who is using it, using a prescription for which it wasn't prescribed to them, or they are obtaining a prescription medication illegally on the black market or by theft or what have you. Now, to kind of give you an idea of what opioid-related harm looks like in Canada, this is current as of March 2020. So between January 26 and September 2019, there was 14,700 apparent opioid-related deaths in Canada. So it's almost 15,000 deaths in 3 years. There was, in that same time period, there were almost 20,000 opioid-related poisoning hospitalizations that occurred, and almost 17,000 suspected opioid-related overdoses occurred between January and September 2019. So it's definitely a concern, not just in Canada, but other places in the world as well. Opioid overdose can result in death and other injuries, but can be reversed by CPR and naloxone administration. So naloxone essentially is an opioid. However, it has the opposite effects of other opioids. So it works differently on our opioid receptors in our brain to reverse the effects of an overdose. Okay, so I'm going to just go over a couple here. So heroin is an opioid, and it's also known as H-junk, skag, dope dust, horse smack, or China white. Pure heroin is a fine white bitter tasting powder. However, when you look at illegal heroin, it is often mixed with other things such as sugar, starch, and something known as quinine, which is a drug made from cinchona bark. It is being found to be increasingly laced with fentanyl, and I'm going to go over fentanyl as well. It is consumed through snorting, smoking, or injecting, and is controlled under Schedule 1. It has been found to be highly addictive, and withdrawal symptoms can actually be quite painful. Harmful long-term effects are both mental and physical. So mental would include difficulty in controlling impulsive behavior, lack of emotion, unstable mood, or suicidal thoughts. Your physical effects are most often linked to the non-sterile use of needles and syringes. And so those would include your skin sores or your infectious diseases such as HIV or hepatitis B or hepatitis C. However, other physical effects include poor nutrition, sexual problems for men, irregular menstrual cycles for women, and cardiac arrest and insomnia. So prescription opioids. These are still prescribed, of course, because some people do need them for pain. They are primarily used to treat acute and chronic pain. So you may have been prescribed them before, or you may currently be using them. Sometimes after surgery, you may be using a prescription opioid short term, just until you have that recovery period. However, use can result in addiction and overdose death. Opioids are actually associated with a 5.5% risk of addiction. So that's why doctors are, increasingly just being careful about how they prescribe them and having those questions prior to prescribing and making sure they do a lot more follow-up. Okay. Non-medical use, as I mentioned before, is when somebody uses it that's not prescribed to them, or somebody has been prescribed it, but now they're using it in a manner other than what it's intended for. So for somebody who's using it for pain, maybe now they're using it throughout the day, even when they're not in pain. So many different forms: tablets, capsules, syrup, solutions, liquid form for injection, skin patches, transmucosal preparation, suppositories, and nasal sprays. Examples, this is very limited, but include codeine, hydrocodone, morphine, oxycodone, etc. Just so you have an idea of what I'm talking about when I say prescription opioid. Yep, Dilaudid as well. Yeah, it's a good point, Lisa. So fentanyl. I do want to mention fentanyl because we've probably seen it a lot in the news as well. Fentanyl is a very potent opioid pain reliever. So essentially a few grains can be enough to kill you. It is usually used in a hospital setting when prescribed. However, it can also be prescribed for out of hospital use by a doctor to control severe pain. So I think a lot of people are under the impression when they see fentanyl all in the news is that it's just an illegal substance. But actually it is a substance that can be prescribed. It just needs to be very controlled. And now, because it's so potent, it's made its way to the black market and being used illegally. It is causing high rates of overdose and overdose deaths in Canada and worldwide. Illegal fentanyl and fentanyl-like drugs are being increasingly found in other illegal drugs. So as I mentioned, heroin is one of them that's constantly being laced. It is 20 to 40 times more potent than heroin and 100 times more potent than morphine. The concern as well is that it's odorless and tasteless, so it's really hard to know if it's in another medication or another drug that you're using, or if it's, in anything else that you might be consuming. All right, so moving on past types of drugs, let's talk about drug effects. So the way a drug affects you is going to depend on a variety of factors, and they're all individualized, but how much is taken, how you take it, and how quickly it reaches the brain. And we're going to be talking about methods of how to take it, how fast it's absorbed, and how quickly it metabolizes or leaves the body. So drug interactions. I wanted to go over this because we want to make sure that people understand that when you take more than one type of drug, there's definitely there's a high likelihood that there'll be an interaction. So additivity, which is just addition, is when you have two or more drugs, they're going to combine to produce a greater effect. So one drug plus one drug equals two. Okay. So for an example of this would, let's say you're taking a benzo and an antihistamine. So for example, if I were to take my Ativan to go to the dentist, but then I also took a Benadryl, I'm going to have an increased effect, right? I'm going to feel even more drowsier, even more impaired. So that's why if I'm taking Ativan, I don't take a Benadryl. Synergism or potentiation is when two or more drugs combine to produce a greater effect than simple adding. So that's supposed to be 1 + 1, not 1 = 1. Sorry about that. So 1 + 1 = 4. So for example, if you take nicotine and amphetamine, those are two strong stimulants. So you're definitely going to have an even stronger effect. And antagonism is when you have a drug combination that reduce and or cancel the effects of others. So if you add 1 + 1, you're going to get no effect, essentially. An example of this I mentioned during our cannabis section is if there's been studies that have shown if you take if you have your cannabis with a stronger amount of CBD or the same amount of CBD to THC, it could either reduce or cancel the effects of the THC. Okay, so drug administration, so how people take it and how fast it's absorbed. So when you're looking at an intravenous injection, so injecting the drug directly in the veins, this would be in seconds. So an example of a drug that's used this way is heroin. Smoking would be seconds as well. Snorting or sniffing would be seconds to minutes. Sublingual, which is under the tongue, would also be seconds to minutes. Rectal or vaginal would be 1 to 2 minutes. A subcutaneous injection, that's injecting the drug under the skin. So for heroin, as an example, it's called skin popping. That's between 15 to 20 minutes for an absorption rate. Intramuscular injection, so that's injecting the drug right into the muscle mass. An example, anabolic steroids, as somebody mentioned, is done that way by athletes. 10 to 15 minutes absorption rate for that. And then ingesting, so either through food or drink, or taking a capsule or a tablet or a liquid, would be 30 to 60 minutes. Okay. Now that we've kind of talked about that, I just want to touch quickly on over-the-counter medications, because there are specific, just because it's not a prescription and just because it's not an illicit drug doesn't mean that there aren't potential harms included, okay? And I think that people with over-the-counter medications take them for granted a little bit. When I ask when I do this presentation in person, I ask who here reads the back of the directions on their cold medications. And maybe, one or two people in the whole class will raise their hand. Most people don't, right? Because we just kind of take it for granted. So these are tips for responsible use for over-the-counter medications. So reading the directions, that would include understanding what the side effects are and the maximum dosages for what age group, because there might be a certain dosage for children versus for adults. Of course, if you're doing a medication for a child, make sure that you're checking the age for the child. Check for contraindications. So those are drug interactions that may be harmful. So for example, some medications can't be taken with alcohol, with caffeine, grapefruit juice, or herbal remedies. I know some of my medication that I've had before prescription-wise, that can be taken at the same time as a dairy product. You also might have some medications that you have to be careful in the sun, right? Consult with a pharmacist if you're not sure. You can talk to them about an over-the-counter medication. You don't have to just talk to them about prescriptions. I've definitely gone up and said, okay, I'm looking for something because of X, Y, and Z. I'm really not sure what I should be getting. Can you help me? Especially if you have, underlying health conditions, you may have to be, more careful about what medications you're choosing. Check expiration dates, both when you're purchasing as well as go into your medication cabinet every once in a while and make sure that you're getting rid of expired medications. Those medications bring to your pharmacist in order for them to be properly disposed of. But if you are using a medication past the expiration date, it's potentially not going to be as effective and it may not be safe to take anymore. And then don't exceed the recommended amount, which I think on certain ones, I think some people exceed, mostly headache medications. So what are some examples of over-the-counter medications that we might want to be more aware of now? And I've mentioned a couple things, but you can just type in the chat. Tylenol, yeah. I think, yeah, Tylenol, Aleve, Advil. So interesting. So those ones I think are the ones that people very often take above the recommended amount, right? So if you look at an extra strength, you're only supposed to take one. I've seen so many people that take two. I used to take two, and then I realized I actually wasn't supposed to because I read the container, right? I hadn't read it for so long because I was like, oh, two is perfect. And I was like, oh, I'm not supposed to. Interesting. Right? Allergy medication, yeah, for sure. Especially, certain medications are definitely going to potentially affect you and your impairment. So Benadryl is a good example of an allergy medication that can cause you to be drowsy. So maybe you don't want to be, potentially going to work, operating machinery, mowing your lawn, driving the vehicle when you've taken Benadryl. If you haven't taken a medication in quite a while, make sure that when you take the medication the next time, you're seeing how it affects you before you go drive a vehicle or operate a machinery. That happened to me. Well, it didn't happen to me. I didn't go drive a vehicle, but I happened to be at work when I took it, which my work is safe. I type on a computer generally. But I took Benadryl for the first time in quite a while. Thankfully, I took it in the morning, so by the time I had to go home, I was good. But I was very, very tired at work because Benadryl used to not affect me, and now as I've gotten older, it's now had more of a drowsy effect on me. So that's my nighttime allergy medication if I need to take it. Yeah, some do cover a 24-hour period as well. So maybe you don't need to be taking medication every 6 to 8 hours. Maybe you need to take one for the whole day. So that is a really good point as well. Yeah, that is a good point, is that the writing is so small on a lot of the bottles and the packages, which is quite frustrating, especially if you have difficulty with your vision. You know, even if your vision's pretty decent, it's still really, really small. So if, for example, if you're buying something in the store and you can't read it, just ask a pharmacist about it for sure. I would recommend that. Yeah, that is why they sell glasses. Yeah, they sell those little reading glasses. Ah, so that's interesting story there, Trevor. Yeah. So told to take Benadryl, super drowsy after. Yeah. You have to be careful about the way that you react. Just because somebody else reacts one way to a drug, and that's for over-the-counter prescription, any drug, right? Just because, or substance, just because one person reacts one way doesn't mean that you will. Yeah, for sure. And it's the same with if you're taking any, if you're choosing to take any supplements or you're taking any medications and stuff, just make sure that if you have concerns or questions, ask your healthcare practitioner or your pharmacist. With prescription medications as well, I wanna do a bit of a warning. Normally, it'll come with the insert that tells you those contraindications, when you should take it, what you should be careful of. And your pharmacist should tell you specific information, as well as there should be warning labels on your bottles. Please do not assume that if there is no warning label or if the pharmacist hasn't specifically told you something, that there's no contraindication. Okay, especially when it comes to alcohol or caffeine. I've definitely seen people that have consumed alcohol and then looked at their medication later, like they've Googled their medication and realized that they shouldn't be consuming alcohol while on that medication, but they didn't have a warning label or the pharmacist didn't ask. So if let's say you want to consume alcohol, you want to consume caffeine, that's something you normally do. When you get a new medication from the pharmacist, specifically ask that question, okay? And they can let you know. Okay. So that is the end of the Understanding Other Drugs section. The last session is next week, which will be Shattering the Stigma of Problematic Use. So we're going to be talking about stigma surrounding substance use and misuse, as well as how to have a conversation with somebody about it, or how to get help for yourself if you're potentially concerned about your own use. So I will put the link right in that box for you so that you have it. There it is right there. So you can go and register for that last session. I will open it up now. If you have any specific questions, you can ask me now. If you would like your mic turned on to ask a question verbally, please do so. While you type, I'll actually do the polls, which I just need to finish up with, which is going to ask you that if you feel I can apply what I learned today in my daily living. So do you strongly disagree, neither agree nor disagree, agree, or strongly agree? Okay, so majority of people are answering here. Okay, so most people feel that they can apply what they learned today, which is fantastic news. That's great. And this last question, how satisfied are you with the Demia platform, so the platform we're using? Are you extremely dissatisfied, somewhat dissatisfied, neither satisfied nor dissatisfied, somewhat dissatisfied, or extremely satisfied? And if you are interested in learning, more about these different types of drugs, if you go to, this is the link, CCSA, so that is the Canadian Centre on Substance Use and Addiction. They have a lot of infographics, Canadian drug use summaries, all of those types of information. They do specifically have sections on their website that, for today's sake, they focus on cocaine, methamphetamine, and opioids, as well as prescription drugs. So definitely have some interesting information there if it's something that you want to learn more about. Okay. So if there are no other questions, I will finish up the session. Thank you for joining us today. Hopefully we will see you for the last session next Thursday at the same time. And enjoy the rest of your week and your weekend. Hopefully have great weather for the weekend. You as well.